Now for next, we'll be addressing basic obstetric skills. Basic obstetric skills. So for basic obstetric skills, we're just trying to talk about for somebody to, at least be called an obstetrician, or to, for students now, it's like for you to say that this student has passed through the obstetric department. There are some skills that at least you should be able to have, right? That's the ability for you to use your hand and perform some one or two things. So their fundamental clinical competence is essential for every healthcare professional to know them. Okay, so they are important in taking care of a woman that is pregnant. Okay, when she's pregnant, when she's into labor, when it's about delivery. So these skills, they ensure that everything you are doing towards this woman is safe. Okay, you are touching her, but you are touching her in a professional way, so it's safe. Okay, so core components of basic obstetric skill is, first of all, understanding the female pelvic anatomy, okay, and all those physiological changes that occur in pregnancy will help you, and the way you approach the woman will also be different. Okay, then antenatal care, knowing how to take history, knowing how to do physical examination for pregnant women, knowing how to monitor how the baby is growing, knowing how to monitor how the mother is growing will all help you. Okay, then identifying pregnancies that will need further help or so, okay, will also help you. All right, so labor and delivery management, knowing the stages of labor and what to do during them. Okay, knowing vaginal delivery, okay, knowing how to deliver the placenta is very, very paramount. Okay, the emergency obstetric skills, knowing how to deal with that bleeding that occurs after pregnancy is very important. That's active management of the third stage of labor. Shoulder dystocia, eclampsia, breech delivery, then knowing how to resuscitate a baby, or how will I put it, a newborn baby, right? So if they are having issues with breathing and all of that, knowing how to actually bring them back to life is another thing. The instrumental delivery is knowing how to use forceps and vacuums, knowing how to do episiotomy, okay, knowing how to suture. Okay, those ones are kind of like advanced skills, but they are still important though. So surgical skills, all those suturing, assisting in cesarean sections, knowing how to communicate well, then be able to do documentation is another thing that is very important. Okay, so these are the basic obstetric skills that at least somebody claiming to be studying obstetrics at the moment should actually have.